Bismillahirrahmanirrahim. Assalamu alaikum, everyone. Today, I am going to present critical appraisal of article Acute Diarrheal Outbreak in 2022, Karachi, Pakistan, to determine its clinical spectrum and risk factors and complications. I am presenting this topic under the kind supervision of my professor, Dr. Saira Afzal, and my name is Dr. Marina Akhtar, PGR Community Medicine. Hadith of the day, the Prophet, peace be upon him, said, "He who is deprived of kindness is deprived of goodness." I'm going to use Strobe checklist for this critical appraisal. Here is Strobe checklist. Abstract of this article is objective to determine the possible source of outbreak and risk factor and suggest evidence-based recommendations for prevention and disease control in Pakistan. Methodology. This cross-sectional study was conducted in Civil Hospital, Karachi, Pakistan from March to May 2022. A total of 90 participants with history of more than one watery stool in 24 hours were included in the study. The data about the demographics, hygienic practices, illness characteristics, treatment, and biochemical parameters, including serum electrolytes and creatinine levels, were recorded. IBM SPSS version 26 were used for data analysis. And results of this abstract is the majority, 83.3% of symptoms were less than 1 week. The mean family size was 6.7, standard deviation 3.2, and 73% of patients had low income. Unfiltered municipal pipelines were primary source of drinking water for 85% of the patient, and 82% drank from tap water. Diarrhea, 100%. Diarrhea was present in 100% of the patient, and vomiting 81%, followed by abdominal discomfort. 53% were the most common symptoms, and 19 patients suffered from acute kidney injury that resulted in the need of dialysis for short time. Among 91 cases, only 7 stool samples were positive for Vibrio cholera. Conclusions. The study suggests the contaminated drinking water is a source of the outbreak, with independent risk factors such as large family size and low income. Vibrio cholera was indicated as causative pathogens, but with a low positivity rate, it may be due to presence of uncommon serotype or mutant variant of Vibrio cholera outbreak. Introduction. Diarrheal illness is one of the leading causes for mortality in the developing countries, especially in the children under 5 years. Studies shows that sub-Saharan Africa and South Africa have around 50 to 150 deaths from diarrhea per 1 lakh. In contrast, rest of the world has below 5 deaths per 1 lakh. Poor sanitation, contaminated food, and pipelines contamination are some known risk factors. The morbidity due to diarrhea also remain essentially unchanged for 10 years. Diarrhea is caused by various pathogens, usually transmitted by fecal-oral route like Salmonella typhi, Shigella, Campylobacter, E. coli, rotavirus, and Norwalk virus. Vibrio cholera alone is responsible for annual 1.3 to 4 million morbidity and 21,000 to 1,43,000 mortality worldwide. Population who do not have access to safe drinking water across the globe is more than 884 million. Safe hygiene practice like drinking pure water, proper hand washing before meals and after toilets, and avoiding uncooked, unhygienic food from roadside vendors can prevent most cases. However, effective treatment lies in replacing lost fluid orally or via IV fluid with antibiotic in severe conditions. Karachi is the largest city in Pakistan despite being metropolitan hub of the country. Water and sanitation remain biggest challenge to date. A rapid rise in acute diarrheal diseases in Karachi was noted in March 2022. Our study is to investigate the outbreak, to describe the epidemiology and identify possible source of the outbreak, and outbreak and risk factor. Moreover, we characterize manifestations of acute diarrheal illness and suggest recommendations for prevention and control that can impact lives of enormous population of this area. Methodology. This cross-sectional study was conducted in Civil Hospital, Karachi, Pakistan from March to May 2022. This study was conducted on patient admitted in Civil Hospital, Karachi, Pakistan. The suspected case of infectious diarrheal illness. Patient presented with a history of 3 or more loose watery stools per day or for less than 2 weeks were included. The 90 patients included were admitted from March to May 2022. And in this study, excluded people having an acute exacerbation of their chronic inflammatory bowel disease, bloody diarrhea, severe abdominal pain, high-grade fever, and patients that had grossly bloody and non-watery diarrhea, along the patient with diarrheal episodes going on for more than 2 weeks. These are exclusion criteria. A 41-item questionnaire was framed and interviews were conducted with all patients meeting our inclusion criteria. We also included data from recorded lab values of the patient with serum electrolytes, creatinine levels. All data of patients were analyzed using IBM SPSS version 26. And lab investigations were also included. Stool samples were collected as a part of initial workup and symptomatic cases sent for culture and sensitivity for common pathogens such as Salmonella, Shigella, Vibrio cholera, E. coli, Campylobacter. Other lab work including CBC, serum creatinine, BUN, and serum electrolytes were obtained from each patient. In this study not conducted a PCR or viral serology for samples, and investigation mainly focused on sensitivity to common bacterial pathogens. Results are shown in this table. Out of 91 patients included in the study, 90 responded to the questionnaire with a successful response rate is 99%. In this table, variables are mentioned: age in years, mean and standard deviations 42 is mean and 18.9 standard deviation, median 43, and range is minimum to maximum age range is 13 to 86. Gender, male are 44 out of 90, 48%, and females are 46 and 51%. Family size, mean and standard deviation is 6.69 and 3.2 is standard deviation, median is 6, and range is 3 to 20 members. Monthly income more than or equal to 20,000, income is 24 of 90, means 26%, and less than 20,000 income in 73% population. And next table is disease characterization in 90 patients. Duration of illness greater than 1 week was in 15 patients, 16%. Greater than 1 week are 75 patient and 83%. Fever afebrile were 85, 94%. High grade fever were 1.1%. Low grade fever were with 4.4%. Or dehydration grade 1, 1.1%, grade 2, 1.1%, or no dehydration, 97%. Number of vomiting per day, 1 to 4 episodes, 40%, 5 to 8 episodes, 12%, 9 to 12 episodes, 4%, and 12 plus or continuous vomiting in 24% patient, and no vomiting in 18.9%. Number of loose stools within 24 hours greater than 10 were in 55% patient, and less than 10 there were 44.4%. Color of stools here is shown, and with the yellow stools 32%. Then here there is tabular representation of lab investigation: sodium chloride, potassium, creatinine level, and this is the normal range, and mean standard deviation, and the range that was noted in the patient. 40 patient, 44% had sodium level below 130, below 135, around 25 patients, or 28% had hypokalemia, and 3% presented with hyperkalemia. The mean creatinine level at the presentation was 2.5 milligram per deciliter, with standard deviation of 0.84, elevated in comparison with normal values. 19 patients suffered acute kidney injury that resulted in the need for dialysis for short time. However, the mean creatinine level came to 0.99 milligram per deciliter after resolution of symptoms. Discussion. In Pakistan, safe access to drinking water, and personal hygiene and proper sanitation are vital to preventing of outbreak of illnesses. In the literature, water source contamination has been reported as primary source of diarrhea outbreaks in various parts of Pakistan. In cross-sectional study, we found that most of population drank tap water directly from pipelines without using any filtering technology or boiling water before drinking. These findings were consistent with an original study in Tamil Nadu that reported the leading cause of acute diarrheal outbreak due to damaged pipeline causing fecal contamination. Our findings regarding family size were consistent with the study of Sierra Leone, where in household size of 5 was associated with diarrheal disease. WHO has introduced several household water treatment and safe storage because of several challenges. The supply of reliably safe drinking water throughout the country has not been possible in Pakistan, and the drinking water across the various parts of country has been reported to be contaminated with potentially pathogenic microbes. To avoid future epidemic, a proper surveillance system for early case detection, ensuring that availability of safe drinking water and ongoing health education are required to establish and execute quick control strategies. Combined efforts from water authority, local government, and public health department are required to pinpoint the actual source of outbreak, increasing awareness at the community level regarding measures that can be taken to prevent the infection from spreading. It also equally important to ensuring the availability and education of oral cholera vaccine. Limitations of the study. The limitation of this study include no case follow-up, no PCR testing in culture negative stool sample for viral causes of diarrhea, non-culturable vibrio produce an acidic environment during intestinal transit or prior antibiotic use or a mutant variant, unavailability of Carrie Blair media, inability to detect uncommon serotype, lack of community level survey. Community level surveys directed at test for pathogens in the water bodies and storage tank would add value for the future studies. Conclusions. The study in the Karachi suggested that the government provide mass education about the use of such water purification techniques. Along the surveillance of water supply pipelines, sewage, and water pipelines should be appropriately separated, and explore future recommendations that could prevent the recurrence of acute diarrheal outbreak in Pakistan. Ethical permissions were also mentioned. Conflict of interest was mentioned. Financial disclosure and grant approval is also mentioned. Data sharing statement is mentioned. Finding of this study on request. References are mentioned in Vancouver referencing style. Now coming to our Strobe checklist. Title and abstract. The study design given in the abstract, it was cross-sectional study. Yes, the abstract is informative and balanced summary of what was done and what was found. In introduction, background, and rationale, explain the scientific background with weak rationale being reported. Objectives are given. In methods, study design, a cross-sectional study was done. Setting, the setting was conducted in Civil Hospital, Karachi, Pakistan from March to May 2022. The study was conducted on patient admitted in Civil Hospital, Karachi, Pakistan with suspected cases of infectious diarrheal illness. Participant and the cross-sectional study, the eligibility criteria were given, but the source and method of selection of participants are not given. Variables are given, but potential confounders and effect modifiers are not clearly mentioned. Data source and measurement for each variable of interest, source of data, and detail of method assessment are not clearly mentioned. Bias not mentioned, study size given, 90 participants, quantitative variables not clearly mentioned, statistical methods are not given or not applicable. Participants, number of individuals given, 90 participants. Give reason for not giving. This study has not given the reason for non-participation at any stage. And results were in tabular form. Descriptive data. Give characteristic of study participants, demographic and social was mentioned in table 1, and number of participants with missing data are not mentioned. And in outcome data, cross-sectional study report, number of outcome events and summary measures are mentioned in table 2, and main result, this is not applicable, other analysis not given, and discussion key results with reference to study objective given, limitations are mentioned, interpretation, overall interpretation of result are mentioned, generalizability not given, funding, no source of funding. Strengths. Titles was concise and clear. Study design was mentioned in the abstract. The abstract is informative and balanced. Scientific background was mentioned. Objectives are given. Source of data given. Setting mentioned. Tabular representation of results and limitations are mentioned. And limitations are rationale of the study was weak, sample size calculation and sampling techniques were not mentioned, missing data was not addressed, method of selection of participants were not given, selection bias not addressed, limiting the data to one city question the generalizability of results. And this is the YouTube link of our channel. And thank you.
Thank you so much, Dr. Marina. Since it is your first critical appraisal, so it was a very good effort. And overall, the presentation was very clear. The slides were very good. And how you concluded on explaining every point, highlighting the strengths and limitations is very nice. But I would like to add few points and few things to explain for your information so that you can learn them but in a better way. So overall, it was a very good presentation, but starting from the title was good. It was giving the agenda or it was clearly defining the objective, but the population which is targeted was not clearly defined in the title. Otherwise, the study designs and other things were mentioned. In the abstract, the objective methodology section, the objective was clearly defined in form of a statement, but in methodology, as you have already explained, that the sample size calculation was not done, and sampling technique was also not mentioned. For an observational cross-sectional study, where you are taking a snapshot image of the population, like you are going once in a field and you are taking sample from as a representative sample. So it's important to always address which technique you are using and how you have calculated the sample size. So here I would like to add a brief summary of what are the sample size and sampling types. There are two types. For Dr. Marina and all the new PGRs, you should read this, that there are two types of sampling. There's probability and non-probability. Meaning that non-probability, every individual does not have an equal chance of having selected in this sample. Whereas in probability sampling, like simple random sampling, stratified sampling, cluster sampling, each individual you are targeting the area, each individual has an equal chance of being selected. So I would request everybody to read the sampling types. And sample size calculation is done on by calculators that are available online, like AppInfo and WHO calculators. So you should go and read those as well. Coming to the result abstract, overall it was okay. They mentioned the results and what was done and what was their objective. Coming to the introduction, the rationale was very weak, as no new information was added, no research gap was identified. They just took the took the help from the literature and just only reported the frequency percentages for the facts that are already known. And the setting they're using is hospital setting. So as you have mentioned that they did not address selection bias. So there is a specific type of bias known as a Parkinsonian bias. Whenever you are in collecting a sample from the hospital, so this might affect the whole results and the generalizability of the result, because you are targeting a hospital, and there are many factors, as like you are already you are selecting those patients that are having those disease, and hospital rates for diarrhea is already high. And if the authors have used a community sample, so the results would have differed. So the selection bias you were talking about could be the Parkinsonian bias, being more specific. And otherwise they did not use any statistical method. So it was a simple observational study reporting the frequency percentages for qualitative variables, and there were mention of mean and standard deviation. So whenever there is a mean and standard deviation, so there is always an indication that they are reporting the quantitative variables as well. So I would like to here add one point regarding the quantitative variables, that whenever they are reporting mean and standard deviation, they are always for the quantitative variables. Like you can say in this form is age, or you can identify the quantitative variables. So so confounders were not mentioned, bias I've already mentioned, and it was there. Result section was simple, neat, with pictorial with the tabular description of the frequencies and percentages, and so socio-demographic factors were also included. So I am now going to conclude it that since no analysis was done, so there is no need to address any subgroup or sensitivity, and as it was not applicable for this study, neither the interpretation and the generalizability, as no hypothesis was set and no no hypotheses were there to be tested or to be addressed. So generalizability, and I think this would not be applicable for this study. So there is a need to do better studies, like more interventional studies, as diarrhea has been a very huge problem in our society. So this would have been improved if the authors have added some kind of statistical analysis, some community household based surveys and multi-center studies to improve their results. So thank you. This is from my side. Now the house is open for discussion. Thank you.
Thank you so much, Dr. Amber. Anyone else want to add more information?
Anyone else who wants to add, or anyone who wants to ask, you can ask, because this was a basic cross-sectional study with